Okay, madam. Start చేయండి.
So, oral cavity and palate. Coming to the oral cavity consists of vestibule and oral cavity proper. Vestibule is nothing but a cleft between cheeks and lips externally and teeth and gums internally. That's about the vestibule. And coming to the oral cavity proper, in front it communicates with the alveolar arches, teeth and gums. Behind it communicates with the oropharynx through the oropharyngeal isthmus. The oropharyngeal isthmus is surrounded above by the hard palate and below by the posterior 1/3 of the tongue, on either sides by the palatoglossal arches. These are the communications of the oropharyngeal. These are the boundaries of the oropharyngeal isthmus. Behind the oral cavity proper, it continues with the oropharynx through the oropharyngeal isthmus. There is oropharyngeal isthmus which is bounded above by the palate, below by the posterior 1/3 of the tongue, on either sides by the palatoglossal arches. Okay, so I'm coming to the roof of the oral cavity. Roof of the oral cavity property is formed by the palate, and floor of the oral cavity, it is formed by the mostly by the tongue, and the floor of the oral cavity, it is occupied by the tongue, and it is formed by the mylohyoid muscles which on either sides, which together forms the diaphragma oris. So that's about the oral cavity. And also the anterior part of the oral cavity consists of sublingual region, and in the sublingual region we will able to see the sublingual fold, the sublingual fold, that is now called as frenulum linguae, and on either side of the frenulum linguae we can see the other mucous folds called plica fimbriata, and plica fimbriata can be seen, and deep lingual veins are seen in the sublingual region, and also submandibular, on base of the frenulum linguae we will able to see the opening of the submandibular ducts at the base of the frenulum linguae, where sublingual papilla are present. So the oral cavity proper consists of that means boundaries of the oral cavity proper. In front it communicates with the alveolar arches, mouth, gums, cheeks, and behind it communicates with the oropharynx through the oropharyngeal isthmus. Where the boundaries of the oropharyngeal isthmus are above palate, below posterior 1/3 of the tongue, on either side palatoglossal arches. And coming to the roof of the oral cavity is formed by the palate, and floor of oral cavity is mostly occupied by the tongue, and also the floor of the cavity, it is formed by the mylohyoid muscle which forms on either side, which form the diaphragm oris. And the anterior part of the oral cavity consists of sublingual region, which consists of a median mucous fold called frenulum linguae, which extends from the inferior surface of the tongue to the floor of the oral cavity. And on either side of the inferior linguae we have only profunda lingual veins are there. On either side we have another fold called plica fimbriata. On the base of the frenulum linguae we have a sublingual papilla are there, where submandibular ducts open. So that's about the oral cavity proper. And coming to the hard palate, it is formed by the palatine processes of maxilla and horizontal parts of palatine bone. So the hard palate, it is formed by the palatine process of maxilla in front and horizontal plates of palatine bones behind. And in the hard palate we will able to see some transverse ridges and transverse folds, which gives the hard palate corrugated in appearance. And coming to the hard palate, the upper part of the hard palate, that means that because we know that the palate forms the floor of the nasal cavity and roof of the oral cavity. So the upper surface of the hard palate, it is lined by ciliated columnar epithelium. That's why, because it forms the floor of the nasal cavity, and the lower surface of it is lined by stratified squamous non-keratinized epithelium. And in the hard palate we can able to see the mucoperiosteum, it is lined by a median raphe, and the transverse mucous folds are thin, which makes the palate corrugated in appearance. That's about the hard palate. And coming to the soft palate consists of anterior surface, posterior surface, upper border, lower border and two lateral borders. And anterior surface it is concave and is directed forwards and backwards, and posterior surface it is convex, directed upwards and backwards. And coming to the upper border. Okay. Coming to the presenting parts of the soft palate consists of anterior surface, posterior surface, upper border, lower border and two lateral borders. Anterior surface is directed forwards and backwards, coming to the posterior surface and presents a median raphe, and coming to the posterior surface is directed upwards and backwards, and it is attached to the palatine crest. And coming to the upper border it is attached to the posterior border of hard palate. And coming to the lower border is free and possesses a conical projection called vivula. And the lateral borders of the soft palate, they are continuous with the walls of the pharynx. Okay. Then about the palatine aponeurosis. The palatine aponeurosis is a fibrous band where all the palatine muscles are attached. So that's the palatine aponeurosis is a fibrous band where all the palatine muscles are attached. Coming to the palatine muscles are four. They are tensor villi palatini, levator villi palatini, and palatoglossus and palatopharyngeus. Coming to the levator villi palatini, it arises from the scaphoid fossa, and it also arises from the medial lamina of the cartilaginous tube, and it also arises from the scaphoid fossa, and also medial pterygoid plate and medial lamina of the cartilaginous tube, and also from not scaphoid fossa, the levator villi palatini, it arises from the apex of the petrous part of temporal bone and from the carotid canal and the medial lamina of the cartilaginous tube. So that is the origin, and the action of the muscle it elevates the palate. The action of the muscle, it elevates the palate. And coming to the other muscle, that is tensor villi palatini. Tensor villi palatini, it arises from the scaphoid fossa, spinosphenoid, and it also arises from the lateral lamina of the cartilaginous tube. It depresses, the action of this muscle is it depresses the soft palate. And coming to the palatopharyngeus muscle, it arises by two fasciculi, anterior fasciculi and posterior fasciculi, and it acts on larynx and pharynx. Last muscle is palatoglossus muscle. The palatoglossus muscle, it arises from the palatine aponeurosis, and it is situated and it is palatoglossus muscle, it arises from the palatine aponeurosis. The function of this muscle is it elevates the tongue, so it closes the oropharyngeal isthmus. It originates from the palatine aponeurosis and it is situated and it is inserted to the lateral sides of the tongue. So that's about the palatoglossus muscle. And palatopharyngeus muscle, it is arises from the two fasciculi from the palatine aponeurosis, anterior fasciculi and posterior fasciculi, and it acts on pharynx and larynx. Coming to the nerve supply of palate, motor nerve supply, all the muscles of the palate, they are supplied by the cranial part of accessory nerve, except tensor villi palatini, which is supplied by the directly branched from the mandibular nerve. And coming to the secretomotor innervation from the superior salivary nucleus, the preganglionic parasympathetic fibers, they reach the preganglionic parasympathetic fibers from the superior salivary nucleus through facial nerve and nerve of pterygoid canal, and they relay into pterygopalatine ganglion. From the postganglionic parasympathetic fibers, they reach the palate through greater and lesser palatine nerves. And the sympathetic nerve, and coming to the vasomotor sensory supply, it is carried out by the greater and lesser palatine nerves as well as long sphenopalatine nerves. Okay, so motor nerves or motor supply is through the cranial part of accessory nerve except tensor villi palate nerve, which is directly supplied by the mandibular nerve, and secretomotor innervation through the preganglionic fibers, parasympathetic fibers from the superior cervical nucleus. They reach the ganglion through facial nerve, nerve of pterygoid canal, and they relay in the pterygopalatine ganglion. From the postganglionic parasympathetic fibers, they reach the palate through greater and lesser palatine nerves, and general sensory by the greater, lesser, and the long sphenopalatine nerves, special sensory by the glossopharyngeal nerve, as well as the greater and lesser palatine nerves. And coming to the arterial supply of the palate is derived from the greater palatine artery, which is a branch of maxillary, as well as ascending palatine artery, which is a branch of facial, and ascending pharyngeal artery, which is a branch of external carotid artery. Greater palatine artery, ascending palatine artery, and ascending pharyngeal artery. And coming to the venous drainage, the venous drainage drains into pharyngeal venous plexus. And coming to the lymphatic drainage of the palate is from retropharyngeal group of lymph nodes as well as deep cervical group of lymph nodes. So that's about the palate. Okay.